Curriculum transformation is the norm of our PharmD program. Our leadership in education requires that our curriculum constantly evolve, and this is ever more urgent today. Classes in our current curriculum, otherwise known as the Pathways curriculum, are taught in isolation, and from the student's perspective, each course bears little immediate relation to the others. We have dramatically reimagined how to sequence this content. Beginning in 2018, the traditional 4-year program will become an integrated 3-year curriculum delivered year-round. An integrated curriculum unifies concepts across all subjects. In other words, it focuses on the connection within the biological, pharmaceutical, clinical, and social administrative sciences. To achieve an integrated curriculum, single discipline courses will no longer be offered. Instead, content will be arranged into blocks of time based on physiological or disease systems. There are 3 fundamental threads that run within the curriculum: the core, inquiry, and experiential. You may be asking yourself, if there are no individual courses, what will I teach? Where in the curriculum will my expertise and skills fit? What does an integrated block look like? To help answer these questions, let's take a look at the cardiovascular block. The core thread is organized around several key cardiovascular conditions that are important for pharmacy practice and therapeutics. These conditions are best explained through a blend of biomedical and clinical sciences. Woven within this time are the social sciences that impact and influence therapeutic decisions. Besides lecturing, faculty facilitate active learning by leading brainstorming sessions in small student groups and case conferences. Technology such as online videos and simulation is used to further enhance the student learning experience. You'll even evaluate student performance by using computer-based examinations and simulated direct patient encounters. The inquiry thread is designed to introduce students to frontiers in research and assure that students can articulate how knowledge and scientific inquiry inform their understanding of clinical problems. Through seminars and small group discussions, faculty will assist students as they evaluate and apply advances in research to patient care. As one example, within the cardiovascular block, students might learn about cutting-edge molecular imaging agents undergoing clinical trials to evaluate cardiovascular function, and then explore the roles pharmacists could play with respect to the study design, chemistry of the agents, and regulatory issues impacting their clinical trials. Over their 3 years at UCSF, in collaboration with faculty, students complete a depth project tackling a research question that will result in a product for dissemination, such as a poster presentation or a manuscript. The experiential thread includes both introductory and advanced pharmacy practice experiences. During the cardiovascular block, students spend approximately 8 hours a week in a community pharmacy. Students will gradually gain skills working with clinicians to ensure the safe and effective use of medications. As a preceptor, you'll oversee them engaging in activities such as medication dispensing, advising and educating patients, checking blood pressures, initiating smoking cessation treatment and counseling, and administering immunizations. A goal of the curriculum is to prepare students for advanced training after graduation that leads to medication expert roles in hospital and community settings, the military, industry, research, academia, and specialized practices focusing on radiopharmaceuticals or veterinary medicine. The 2018 curriculum is contemporary, innovative, and radically different from our current approach. It reflects the dedicated commitment of faculty, preceptors, and staff to educate students who think critically, problem solve, and work effectively on teams.